whether you are a municipality or whether you are a board of education, how do you investigate these claims? Well, you have to do a very good interview. And you may have to interview co-employees too, okay? So we're going to talk about whether to accept or to deny a COVID claim. All of you know at this point that things are different today in October than they were in March, okay? First of all, I read today that in New Jersey, almost 250,000 people have been diagnosed with COVID. We have a population of 8.5 million people, roughly, okay? And doctors say that for the $250,000 who've been diagnosed with COVID, there's probably at least double that who have it, but they haven't been diagnosed. So let's assume 500,000 people in New Jersey have COVID. That means about 1 out of every 16 or 17 people have COVID. And a lot of people are getting it in the community. They might be in a supermarket. They might be outside talking to their neighbor. They might have been at a gathering, a family gathering. Not everybody gets it from work, okay? So what we need to do is figure out, what have you been doing? We don't need to, if we have a COVID case in November of 2020, we don't need to know what you were doing in March. Because as you all know, there's an incubation period. That's maybe 2 to 14 days. So if you were exposed to COVID in March, you're not going to get it in November, okay? So we're going to focus on what you have been doing over the past few weeks. Did you travel out of state? There are 36 states that are on a list now that if you travel to, the state wants you to quarantine for 14 days, okay? So there's a lot of ways to get COVID besides work. Now, many people think they got it from work, but if all they can say is, I think I got it from work because I don't think I got it from home, that's not going to be persuasive to me. But you do have to interview people and you have to ask questions before you accept or deny. So let's go over some of the questions that I recommend that all employers ask about, okay? And this is on a form. I actually have a set of questions. You're all welcome to it. And it looks much easier than this because this is broken up on slides, but I have a 1-page form that I will send Danielle and Zach and anybody else who wants it. Just email me at jgainey@capehart.com. These are practical questions. So the first one is really, really important. Who is your family doctor? And what is his or her address? Now, why would you think that is important, John? Well, here's why. Because if one of your employees says, I think I have COVID from work, and you say, well, did you call anybody? And they say, yeah, I called my family doctor. We want to see the records because this is what doctors do. Doctors will say something like this. Well, who do you think you were exposed to? Does anyone in your family have it? Did your sister have it? Did your brother have it? That information is going to be in a medical record, and it's going to be probably the first discussion of causation in any file. Your conversation is going to be later after that. So the doctor's going to say, why do you think you had it? And who do you think you're exposed to? Well, I was at a football game last weekend. Okay. Now, that will pretty much undercut the comp claim. So we want to know that. Have you spoken with your family doctor regarding the coronavirus, and when? If you believe you were exposed to the coronavirus at work from a specific person, when did you work with that employee and what contact did you have? Now that's really important. And remember, we're talking about physical proximity. If you're 40 or 50 feet away from an employee, you're probably not likely to get the coronavirus from an employee. But if you're within a few feet and that person was COVID positive and you're working over a longer period of time, then there is a good chance. So we want to pin that down. How often did you work with the employee or those whom you believe exposed you to the coronavirus? 1 day, 10 minutes, 5 minutes, or every day? Let's go to the next slide. This is sort of a follow-up on the first question. Have you been admitted to any hospital in relation to the coronavirus? And if so, when? Why do we want those records? Again, because those records are going to have your statements when you went into the hospital as to when you think you got it and how you got it. What was the last date that you worked for your employer? That's really important because I have quite a few cases now where a person has stopped working for a hospital. I represent 9 hospitals and they're big. And we'll have a situation where a person says, I last worked for the hospital on March 7th. And the diagnosis and the symptoms was late March, like the 28th. In all likelihood, that's not possible that you got it from that last employment on the 7th if your symptoms didn't start on the 28th. That's what doctors say. Now, when did your COVID-19 symptoms first appear? That's important too. You know, that could be a few days after or several days after the exposure. Do you have any relatives or friends who are COVID-19 positive? Here's where I'm really focusing in the questioning, because if your spouse or your significant other got COVID before you did, and you're sharing the same bed, and you're around that person all the time, that's going to tilt, in my opinion, that's going to tilt the case more to a denial. How often have you been around this relative or friend in the past 2 months? Okay, let's go to the next slide. Have you traveled anywhere in the past 2 months? We talked about this. Like I said, New Jersey has 36 states that they're concerned about, okay? And I read today, by the way, when COVID came out, New Jersey had by far the highest rate of fatalities and the second highest number of cases. Well, that's not the case anymore, okay? California, Texas, Florida, and other states have passed New Jersey, not only in deaths, but also in the number of diagnoses. So California and Texas have almost 1 million. So that's like 5 times New Jersey. Has anyone visited you from another country in the past 2 months? That's probably going to be a no, but that's how a lot of people got COVID in New Jersey in February and March. It was people flying in from Western Europe. Have you gone to church or attended a gathering of friends? We talked about this. You've read about this. We certainly, Dr. Fauci has emphasized this in numerous public appearances and statements. So it's important to know, where do you go? Are you hanging out at wedding? Have you been at weddings? Have you been indoor? You know, obviously outdoor weddings a little safer. Have you shopped at any grocery stores in the past month? If yes, what store and how often? Well, fortunately, the stores I've been shopping at require a mask. I think that's pretty much universal in this area. And if everyone's careful, we should be okay. And you have to social distance. Are there any other reasons that you have left your house in the last month prior to diagnosis? Okay, let's go to the next slide. Have you spent time with anyone in the past month whom you know was very sick? Now, some people are going to say in the healthcare profession, yes, I did. I was taking care of people who were COVID positive. And I have those cases. And that makes it very hard for us on the question of whether that arises out of work. It probably does arise out of work then. They still have to prove permanency though. Have you received a positive COVID-19 test result? We need to know that. A lot of the test results have gone back and forth, negative, positive, negative, positive. When did you take the test and where? What was the date you were diagnosed as COVID positive or negative? Now let's shift to the symptoms. What symptoms are you presently having? That's important. We need to know if those are symptoms that you've had for a long period of time, for years, because that may help us when we get to the permanency. We also want to know if that's even compatible with COVID. Do you have any unrelated medical conditions for which you are taking medications? This becomes crucial in the comp cases because, as I found on many of my cases, people are saying they have problems with their lungs, and we're doing discovery, interrogatories, and we're finding out they have had problems with their lungs for years. They've been on allergy medications, they've been taking inhalers. So we've got to separate now what's really from COVID and what's not. All right, let's wrap up on these slides. Are you presently in quarantine or in isolation? Well, that's obviously important, and anybody who's calling you with symptoms of COVID should be in quarantine. Whom do you live with, and are there any of your family members in quarantine? Did any of your family members go into quarantine before you did? And the last question, you'd be surprised how often this is a factor. Do you have any second jobs? And if so, please identify the employer. Now, I have at least 5 hospital cases with COVID in the courts where the employee worked at 2 hospitals. So they have part-time job, EMT here, full-time job here, 2 full-time jobs. So how do we sort it out? Well, that's what we're going to do in court. We're going to be asking a lot of these questions. Okay, so